Moving on now, patients could pay less for a trip to the doctor under the government's shake-up of Medicare. That's if the health funds get their way. Insurers are pushing to cover out-of-pocket costs on gap fees for GPs who no longer bulk bill and medical treatment out of hospital where there is a Medicare benefit. Many believe the move would be a welcome reprieve for lower and middle income families, helping address the rising cost of living. Joining us now for more on this is Natasha Robinson, the health editor at the Australian newspaper. Natasha, appreciate your time. Thank you. You've written about these issues today. More broadly, when we talk about fixing Medicare, what are the major changes that we can expect from the government this year?
Yeah, well, this Medicare reform has really been a long time coming. The Labor government, of course, made it a central part of their election platform, and it was very sort of light on details at that time. But, you know, of course, they are the party that is synonymous with Medicare, it having been created in 1984 under Bob Hawke's government, and it's very much a prized Labor piece of policy. So they could see the trouble that Medicare was in, a really serious growing crisis that's been reflected really in primary care systems as well as hospitals right around the world. So I think at that time they knew this would be something that they could perhaps really create a legacy in for Labor in terms of ushering in the biggest reform to Medicare since its inception 40 years ago. So the things that they're looking at are, you know, really a shift away from what has been the model for Medicare ever since it was first created, which is known as the fee-for-service system. And that is that the GP gets paid according to a schedule of Medicare benefit items. You know, the 20-minute consultation attracts a rebate of around $39, and that's by far the most common rebate item that is billed to Medicare. But it's become increasingly apparent as we've moved you know, towards a sort of more, you know, an older society, an ageing population, and the prevalence of chronic disease has been rising and rising, and it's been increasingly apparent that this system of this fee-for-service system is broken, and it is not addressing the needs of patients who are dealing with multimorbidities that, you know, are just not being well managed just by this system of just going to your GP for a short consultation and then having to go back again and again and again. And of course, costs have been rising because so many GPs are pulling away from bulk billing, saying they can't afford to provide it anymore. So what is needed, and you know, the entire health sector really, to a greater or a lesser extent, is on the same page with this, is a system where teams of practitioners can address chronic disease and really meet the patient's needs. So this could involve, you know, nurses, paramedics, physios, dietitians, podiatrists, you know, the whole gamut, working all in a collaborative, coordinated system. And so the funding model has to adapt to be able to fund that, because at the moment, a nurse, for instance, they give you the vaccination, they can't be funded to do that. So you would have noticed, if you've ever been in that situation, the GP sort of pops their head in and says, "Oh, how's this all going?" And you know, really, they're there for no reason at all, other than to make sure that that fee, that funding, can flow via Medicare. And look, that's just a waste of time, clearly. So the system needs to adapt, but it's going to be quite a lot of detailed policy work that needs to be done leading up to the next budget, and of course money put on the table as well for this.
And so when we look at the politics of this, Natasha, you noted in your piece today that the Federal Health Minister, Mark Butler, you described him as playing clever politics around this. How so?
Yeah, well, as I say, I think they've seen the problem, the dire need for reform in this area, and they know that they are the government who can deliver this. As a Labor government, bringing Medicare into the 21st century, it's a very it's a very attractive proposition, I would have thought, for a federal health minister looking to stamp their legacy on the portfolio. So I think in terms of the clever politics that I was talking about, he's brought everyone under the umbrella. So he's immediately created that task force. They've sat down for 6 months, straight after Labor's election, discussed all the issues. They had a really good base to work from because they'd already done a lot of policy work and collaboratively come up with a 10-year primary health plan under the previous government. And that was, a pretty good document, but it didn't actually have funding attached to it. It had some funding put on the table and then it was taken away. So the sort of this free-floating sort of piece of policy without any resources behind it. So that's been their sort of basis, and that's a really good basis. And then they've, brought these discussions forward to the point of reaching, a high degree of consensus around 3 key recommendations. We are told, which are, around this multidisciplinary team-based care and, a system of what's known as voluntary patient enrolment, where a patient would sort of sign up with a home practice and that practice would then be funded to kind of coordinate their care, which, addresses that issue of, the GP just not having the funding to do that coordination and work collaboratively with allied health practitioners at the moment. And the other thing they want to do is really reform the digital systems to bring the kind of, I think my health record is, I don't think it's unfair to say it's been, somewhat of a miserable failure. But there's a lot of potential there. And at the moment, there's really big problems in terms of, like GPs having no visibility whatsoever around, what's gone on for a patient in hospital, for instance. So, I think that's a sort of, nobody's really talking much about that, but that is an enormous, that kind of reform could actually have enormous ramifications for patients. All sorts of things that, go wrong at the moment in terms of medication management and one doctor not knowing, what drugs someone's on and, the patient being confused. So, all these things I think could have really far-reaching ramifications for patients and how they experience the health system.
Yeah, Natasha, I think we'd all like to see the system operate a whole lot better. So we'll watch with interest as these reforms are pursued by the government. Appreciate your analysis. Thanks so much.
Thanks, Ash.